8:25 the time. Scottish scientists have made a key discovery in how bowel cancer, which is increasingly being diagnosed in younger people in Scotland, is able to disguise itself and spread around the body. This is a study from Cancer Research UK Scotland Centre and the University of Edinburgh, and it's hoped that the identification of a crucial process and preventing it from occurring can actually help make current treatments more effective. Let's speak to Dr. Kevin Myant, who is from the Institute of Genetics and Cancer at the University of Edinburgh, as well as the Cancer Research UK Scotland Centre. Morning to you, Kevin.
Hi, good morning.
Explain to us what you found here. You found that these cancer cells can mimic skin or muscle cells.
Yeah, that's right. That's exactly what we've found. So basically, we've been studying aggressive colorectal cancer that spreads around the body. And what we've found is that the cancer cells from the bowel can start to shapeshift and resemble cells from other parts of the body, like the skin or muscle cells.
And does that mean the body's more receptive to helping those particular cells?
So what we think is that, so if you think about the different tissues in your body, the skin is particularly resilient and robust. So what we think is happening is that they're taking on the properties of skin to become more resilient, more robust, and that allows them to spread and survive in different organs.
And does that make the cancer more aggressive?
Yes, it makes it much more aggressive. It makes it harder to treat, so they don't respond as well to therapy either. So overall, it's a way that the cancer cells can kind of survive in hostile environments.
So having made this discovery, where do you take that?
So what we hope to do and what we're doing at the moment is now that we understand that this happens, we now want to understand how it happens, what the exact purpose of it is, and then ultimately develop therapies that can prevent it from happening. So we think if we can stop this shape-shifting ability, we should be able to stop the cancer from spreading and make it more responsive to therapy.
And is this a cancer that does spread quite aggressively, or potentially can all cancers behave in this way?
Yeah, so that's a really good point, actually. So there is growing evidence that this type of process happens in other cancer types as well. So it seems to be, perhaps a universal mechanism that different cancer types use to spread. It's been seen in pancreatic cancer and breast cancers, for example. So it could be something that is not restricted to bowel cancer and is more important generally.
I talked about preventing this if you can and helping making current treatments far more effective. What do you need to do to reach that stage?
Well, we need to, develop therapies. We need to detect the cancers earlier. So the other possibility is that this could be used as a biomarker for cancer that is likely to spread or is likely to resist therapies. So we can use it in a clinical setting in multiple ways. But at the moment, our main focus is to try to develop new therapies that can prevent this from happening, with the hope of getting real patient benefit.
I presume that would mean catching the cancer at an earlier stage. Exactly, or as early a stage as possible, at least.
The earlier, the better. So there are bowel cancer screening programs that are designed and set up to do exactly that. And I think that the key thing here is just making sure that the uptake for them is as high as possible, so that as many people get diagnosed as early as possible.
Yeah, I mean, I've taken part in some of those screening programs. Over 50, you get sent a little stick in the post, obviously. But This is something that we're seeing in a cancer that's being diagnosed in more younger people too.
Yeah. I mean, so the rates of bowel cancer diagnosis in younger people is rising and rising quite rapidly. So it's likely due to changes in lifestyle, environmental factors, changes in diet. Sort of ultra-processed foods are sort of thought to potentially be a link to that. So the diagnosis is starting to shift and get earlier, but the screening doesn't happen until 50. So there's a little bit of a kind of a gap there where people are maybe not getting screened, and then they maybe get diagnosed with later stage, more aggressive disease.
Well, Kevin, we will keep abreast of your research. Thanks for speaking to us, Dr. Kevin Myant there from Edinburgh University. The time